And a very warm welcome. You're joining us here at Hyde Park on Derana 24. And here tonight, we will be talking about something different. Not politics, not business, not about the economic situation in the country, but the importance of giving the gift of life. Here, we're talking about an incredible situation that can save up to 8 lives with just the donation of one person's organs. So this means one organ donor can save up to 8 lives and improve the lives of up to 50 persons. Incredible. And I think here in Sri Lanka, we're trying to understand how this situation can improve more lives and save more lives in the country. To discuss all this, I've invited to our studios someone who represents a country that has pioneered and is the leader in organ donation. Let me warmly welcome the director of the International Development Donation and Transplantation Institute in Barcelona of Spain, Professor Chloë Ballesté. A very warm welcome to you.
Thank you very much. Thank you very much. I'm very honored.
Certainly, we'd love to speak about Spain, the pioneering initiatives that have been taken, and also how you can help improve Sri Lanka's situation here. I'd also like to introduce somebody who has pioneered the organ donation campaign here in Sri Lanka and the initiation of national organ donation in Sri Lanka back in 2018, none other than consultant urological and transplant surgeon at the Sri Jayawardhanapura General Hospital in Sri Lanka, Dr. Niroshan Seneviratna. A very warm welcome to you. And Ayubowan. You're the co-founder and of the Organ Donation and Transplantation Foundation here in Sri Lanka. A lot of work has been done so far. But let me start off with Dr. Niroshan. What's the situation here in Sri Lanka? We understand that Spain is leading, and it's phenomenal that one person's organs can save up to 8 lives and improve up to 50 lives in the process. But how is the situation in Sri Lanka? Do we understand this?
Well, in the current situation in Sri Lanka, is not looking that great in the sense of many people do die from organ failure. As you know, kidney failure is a huge problem in our country. And many people, children, young adults, middle-aged people die without an organ. And not only kidney failure, there are many other people who die from liver failure, heart failure, lung failure, and pancreas failure, and so on. So when someone reaches this end-stage disease, the only way that these people can live with a better quality of life is by having a new organ transplanted. Now, for instance, in kidney, fortunately, there is dialysis, which is like a bridging thing. But as you know, dialysis is a temporizing issue for them to live when they reach end-stage disease. So when someone comes to this stage, fortunately, because there are 2 kidneys, one person, a living person, can donate a kidney. And also a part of liver can be donated as from a living donor. But if you take the other organs, and because of many other people are dying without an organ, the way forward for this transplant is to get organs from dead donors, so which is called disease donation. So in that sense, we are still at the infancy, but we have to do a lot of work. We have initiated to do some work. So the whole idea is to promote this concept of dead donation, where one can donate 8 organs and make 8 people live with better quality of life, and also 50 tissues can make other people's life better. So this is the whole idea behind this.
So we know this here in Sri Lanka. How far have we come?
So in terms, we know in terms of living donation, our transplant is mainly kidney, predominantly is about 90%. Liver in terms, it's about good 40 to 50% is from living split liver, which means a part of the liver is taken and transplanted. But the disease donation is still at infancy. So only a very few number of donations can from disease donation. As you know, currently there are about 10,000 people die every year from kidney failure. And about 200,000 people are suffering from end stage, that means the last stage of kidney failure. But if you take in numbers, the number we transplant per year is roughly around 200 to 250. And that is because predominantly we don't have enough organs coming from dead donors. So what you're trying
to also say is that from 250 to 300?
Yeah, yes, correct.
Yearly. Annually, you can improve this if there is sufficient awareness and more people contributing and signing up for organ donation, I believe.
That's correct.
I'd like to turn to Dr. Chloë Ballesté. I hope I'm pronouncing your name right.
Perfect.
From Spain. Your country remains the world leader in organ donation for 32 consecutive years. And this is an amazing development, remarkable contribution to humankind. What is the situation there? How many organs are donated? How many lives, the important question is, are saved there in Spain?
Well, yes, it is true that Spain has been leading in the last 30 years already in terms of deceased organ donation. So what Dr. Niro was just saying is really important, because you've got mainly two ways of getting organs for transplantation. One is living donation, in where you put in risk the life of someone who has a normal life and quality of life, and also there is a risk of coercion of this person or even of some organ trafficking. In deceased donation, you need a bigger organization. You need to organize it better from inside the hospital, and this is how Spain, so I'm going to try explain a little bit how we reached that number, but it's not only Spain, it's about other countries also in Europe who have followed, and in the world who have followed this model, and who has been able to improve disease donation. So in this moment, just for you to have an idea, in the world, we are only able to transplant 10% of the needs. Sri Lanka, as Dr. Niroshan was just saying, has around 3.5 donors per million population, deceased donors. And in Spain, we have 52 donors per million population. So these, as a result, we are able to transplant much more people. In fact, in Spain, in this moment, for liver, we are waiting in the waiting list around 3 months only, while in most of the countries is a minimum of 3 years waiting. So the more donors you have, the more transplant you are able to do. How did we reach that? First of all, by having a very strong commitment of the government. So we have centralized the activity. And thanks to that, we are able to have a transplant director and an office that make the process transparent. We have centralized registries, allocation system. But then, from the hospital point of view, it's really important to work from inside. So we have units that are multidisciplinary units, but led by a doctor, who are focused on organ donation. So it's part of the mission of the hospital to have donors. And in fact, having brain death cases, which is something that happens all over the world, it's a good indicator, a quality indicator that the ICUs are working properly. So it's really a change of culture, first inside the healthcare institutions, and then the population somehow follows that success. But they need to trust on what you are doing, and you need to be totally totally transparent on the whole process.
What was it that you mentioned about the brain dead cases? What does that mean? If it's a brain dead, a donor who has signed up to donate their organs?
So that's a really important medical situation that not only population should know, but professionals should really understand clearly. This is a new concept, I'm talking about the 60s, 50s, in where we started having people that were in a very deep coma and that were under a ventilator. Yeah? When the ventilators appeared, we find out that there were some people that were in coma, but they never were able to get out from this coma. And the reason why is because the brain was dead. There was no blood perfusion, no oxygenation, and the damage to the brain was absolutely permanent and irreversible. So it's the death of the person, but from a neurological point of view. So before we were only used to diagnose death by cardiorespiratory criteria, and this is a neurological criteria. And this is a status that, of course, the only way when you have a patient that is in brain death would be to disconnect the machine because the person is dead. But you have the possibility to become a donor at this point because the organs are still perfused with blood and with oxygen. So you have some time to recuperate these organs.
How long do you have?
Usually it's around few days, no? So of course it needs a very proactive approach in the ICU. You need to take very good care of these organs in the ICU, but there is a limited time, never more than few days.
I'd like to speak more on how this is identified and how even the signing up process is. Whether relatives come in into the situation, how the legal situation supports such donations in the event of a brain-dead patient. I understand you've been doing a lot of research. Dr. Niroshan has been telling me that you've been studying Sri Lanka's situation for the past 4 years.
Yes.
What is your understanding about Sri Lanka's situation and readiness to support these complex situations?
Well, I'm very, very positive with Sri Lanka's situation. First of all, because you are not starting from zero. So I think it's really important for everybody to know that Sri Lanka is an example in cornea donation. It's the country that donates more corneas in the world. And you are able to share it with other countries. And this is all because there is people that are willing to do that. And this is really extraordinary. So it's not about only the generosity of the population, that I'm sure that's gonna happen. It's about working inside the hospital. And we've got some examples, and in fact, in these 4 years, we have been working with the University of Barcelona together with the Hospital of Sri Jayandenapur, and they have organized inside the ICU with anesthesiologists and intensive care staff a unit for organ donation. So the culture inside to make sure we are not missing any possible donor and that every family gets the opportunity to donate. I think that's the important message. The law needs to be there, and I think Dr. Niro can explain better what is the legal situation in Sri Lanka. Everything is ready. Sri Lanka is a country that has all the bases to do that, but now we need the doctors and nurses to work proactively, so they need some further training to get professionalized on that. Sri Lanka needs to have this centralized office to make sure the whole system is totally trustable for the population, and then the population will follow for sure.
Wonderful. Dr. Niroshan Seneviratna, who has been leading this initiative in Sri Lanka. I'd like to turn to you. I think Dr. Chloë has explained to us what the situation there in Spain is and how the trends are globally. But in Sri Lanka, I think you mentioned about kidney transplant and liver disease, how patients suffering from these diseases can have some respite with this kind of donations. But is our ICU capacity sufficient? are our hospitals' infrastructure sufficient to enable these kind of donations? And when we say give life to 8 other people with one person's organs, this is a phenomenal situation.
Yeah, it's true that, I mean, there will be no limit for requirement of ICU beds because we need a lot of numbers. But if you see the West also, they also struggle from ICU beds. But the whole idea is to have the different mindset and the culture. Look now, when such person is dead, for instance, brain dead, what we want is to make the diagnosis of that person is dead and to make that particular ICU bed available to save another person's life. But people do forget this person, if becomes an organ donor, he can save 8 other lives. So it's the mindset of the ICU team, the critical care team to think and give that option to the patient's family whether that person can become an organ donor.
So if this is to be done, you have to be a patient at the ICU?
Correct.
Prior to demise?
Correct. Because now the whole idea is if a person is brain dead, that means that person has had a devastating brain injury and has an irreversible brain damage. So it may be a road traffic accident or a stroke where the blood supply has stopped, or maybe a blood clot in the brain. So in that situation, these patients are managed in the ICU to try to save the life. Because they are in the ventilator and because they are with special drugs, even if they are brain dead, the rest of the organs can be kept viable for some time. That's why Professor Chloë said maybe for a couple of hours, maybe 1 or 2 days.
Right.
Now, the people who is unaware of this situation, especially in our setup where a lot of young people die with road traffic accidents, it's very difficult to convince the family to understand that your loved one is dead, because once you go to the ICU, you see the ventilator, the lungs are moving, ECG monitor is working. So they don't understand that their loved one is dead. And at that grieving moment, it's very difficult for us to convince them that they are dead and to ask for organ donation.
And even for the families to take such a critical decision at the time.
Exactly. So that's why, like in the West, we want to promote that people do get registered when they are alive for organ donation. So upon registration, that is not a guarantee that we are going to get the organs, but it is easy for the ICU and the critical care team doctors to have a discussion with the family. Look, your loved one is now dead. His last will to donate organs. So if you're willing, let's get some organ and make somebody else live. So that is the whole idea of this process.
And it's not just one person, it's not just somebody else, it's going to be 8 other persons. But how does the process work, Dr. Niroshan? If the patient is not someone who has signed up on the registry for organ donations, while you're at the ICU, can the family make the decision on behalf of the patient?
Yes, they can. So once a person is brain dead, the doctors do series of tests to ensure that there is irreversible brain damage.
Right.
And the person cannot sustain life without, the organs cannot be kept viable without the support of the machines.
And how long does these tests take?
So these tests takes about 15 to 20 minutes. So they are done in 2 separate occasions by 2 independent doctors at 2 instances. So altogether 4 times we do this so that we ensure that that person is brain dead.
Right.
So once we do that only, we pronounce the patient is dead.
So how long do you have during that time and upon the person's death to transfer these organs to keep them in a safe manner and to transfer it to a deserving patient.
So that's the critical point, isn't it? I mean, depending on the brain injury, sometimes it may be few hours, but sometimes it may be 1 or 2 days. So that's why it's important that the family understand and consent early, because the viability of the organs gradually goes down. So it's important that the decision is made early. Because for instance, sometimes everybody in the family is agreeable, but there is somebody, for instance, the own brother is abroad, and they want the brother to come to Sri Lanka to see whether something could be done. You know, we have come across some situations. So then sometimes, you know, the rest of the organs viability goes away. So it's important that if we diagnose the condition early and organ donation come forwards, then we can get 8 organs and make 8 people live.
Dr. Chloë, are there any specific medications that are used in the case where a patient is diagnosed or is pronounced brain dead in order to prolong the organs?
No, in fact, to take care of these organs, the ICU staff needs to be trained for that, because this is a different situation from keeping someone alive. But any country can do that with with all the resources that they have. So this is not the burden. The burden might be not to be able to make the people understand the situation. And in fact, what it's terrible here is that you have to announce the death of the person, and this death, sometimes it's difficult to accept. But then the donation, the more the people will talk about that, being alive with their families, the easiest it will be for these families to take the right decision at this very, very complicated moment.
How is the legal situation really arranged there in Spain, especially when we talk about managing these critical moments from a family understanding the situation and also ensuring that the family agrees to donating organs to keep alive 8 other individuals? How does the legal framework, regulatory framework come into play here?
Well, what is common in between our 2 countries is that we've got a law that explains the situation of brain death. So that's really important, because there is no doubt on the idea that brain death is equal to death. And then afterwards, regarding the consent of the family, there are slight differences. No? In Spain, we've got what we call an opt-out system, which means that the whole population is supposed to be a donor if they haven't said the contrary during their life. While in Sri Lanka, the people should have said yes during life. But in the reality, at the end, is the same, because in both countries, very few people would get into the registry. So what it's really important is that inside the hospital, the right people, the right healthcare staff will talk with transparency, respect, and explaining everything in that difficult situation to the families. Because the law, at the end, what it is saying is that what we want is to know what the person who died would have wanted regarding donation.
How long ago did Spain really bring in these systems and the kind of infrastructure necessary to support anyone willing to keep alive another person, anyone who wanted to be a part of such a massive initiative?
So in Spain, it started in the late 80s, and it was because of the people suffering from kidney disease. Because as Dr. Niroshan just said, there is the alternative of dialysis. But it's really important for the people to understand that dialysis, the quality of life of someone who's going through dialysis, has nothing to do with someone who has been transplanted. And on the other hand, it's also very much cost effective, because dialysis, 1 year of dialysis, is equal to 1 whole life of transplantation. So for the country is also something that it's from a budget point of view, it's good to do transplantation because you're really saving a lot of money. And then in Spain, it's the people who were ill that ask for changing that and to do more transplantation. And it took some years, but it is really interesting to see that a country like Spain, that is not very well known by being wealthier than other countries in Europe, has the best system, together with Portugal, with Italy, which are countries that are not having an extra budget. So it's more about organization, about the willing of the government to really go through that. And another important point is that you don't need to have many transplant centers. The fewer you would have, the higher experience they will get and the more cases they will do.
Right.
So you don't
so that
need
they are more specialized in
exactly.
In
so that's also an important point.
Right. It's interesting how the system has evolved over the years. How do we really bring that kind of system here, Dr. Niroshan? I believe you've been trying to understand the situation here and to introduce more systems. While responding to that, if I'd also like you to maybe explain to us how it works. Now, we also have patients going to state hospitals, government hospitals, semi-government to private hospitals. How would the coordination of these work in a situation where a patient has already registered or someone who is pronounced brain dead and the families accept or are willing for the patient to donate their organs?
So I think it's very simple, as Chloe said, is the transparency is the key word.
Right.
So there are obviously two registries we need. So there is one who will willing to be donate organs, so which is called a donor registry. That's where we have come forward and introduce a donor card, and so that they can register while they are alive. At the same time, we have a registry for patients who are in organ failure. For example, kidney failure registry, liver failure registry. So irrespective of whether the patient is treated in the government sector or in the private sector, if there is an option of an organ, then based on certain criteria, for instance, what is the waiting list time, how long they've been dialyzed, so on, and what is the age they have been suffering this disease. Based on a marking scheme, so the organs can be allocated on an equal basis. So it's important to have these registries, and it's very important that we have a centralized body who regulate that, and that's where we have to improve.
So we currently don't have that centralized regulation that we're talking about right now.
We do have to some extent, but as Professor Chloë said, we want to have a dedicated transplant body, so who at the ministry level, who will see all these programs running with transparency.
You mentioned about kidney disease to liver disease, but I think one may wonder how 8 other persons could be kept alive. I have a depiction of where the organs can be transplanted in the case of upon death of a patient. If you can explain to that, I think everyone wants to know how, you know, your organs, which are all located in one person's body, can actually help 8 others.
So it's a very complex process. I mean, as you by now understand, when a person is dead, the viability of the organs can be kept only for a very short time. So in Europe, when we were training, and our experience is that when one such organ donor comes, there are different surgical teams. For instance, kidney team, liver team, heart team, lung team, all they go and work collaboratively and do a surgical procedure and take these organs out from that particular donor. At the same time, there are other transplant centers bringing in the recipients who will need the heart, who will need the lung, who will need both kidneys. So those centers bring the recipient and get them ready for transplantation. So there is a lot of coordination going within a span of 24 to 48 hours, so that 8 organs can be transplanted at different hospitals.
Right.
So it's a quite complex. It's like a pit stop. It's like that kind of situation. The whole transplant process.
And what are the organs that can be donated?
So we have 2 kidneys. So we have the liver, 2 lungs, heart, pancreas, and the bowels.
Right.
So all in all, 8 organs can be transplanted to 8 people.
And I was also looking at statistics where you say 50 lives can be improved, and the donation of stem cells and skin. I'm trying to understand this.
That's what we call tissues. And tissues might be the corneas that I mentioned before, the skin, cardiovascular also tissue like heart valves or veins or arteries. You've got musculoskeletal, which is different parts of the bones, tendons, and so on. So all these tissues are not considered as being vital as the organs are, but it is absolutely necessary. The skin, for instance, for burned people is the best apposite you can have, better than any other artificial, because you also reduce the pain. And this is much cheaper also. The same with the cornea. Someone who's blind, you can give back the vision of someone who has not been able to see for years or for. So it is really important not to forget that. But as I was mentioning before, I think in Sri Lanka, if these organizations get more professionalized, it's going to happen because you already have a tradition of donation. And you're a population that is very generous. So this might happen. From DTI, we have had the opportunity to be in over 100 different countries with different religions, with different cultures, different healthcare systems. And at the end, what makes the difference is the professionalization of the activity and making sure that the organization is also supported by the government. So if you've got all these elements from the top down and bottom up, this might happen, as it has happened in China, in Thailand, in the Philippines, and nowadays, really Sri Lanka is leading the Southeast Asia donation. So you're in the good path.
Right, I think it's time we take a quick break here at Hyde Park and discuss further. We are in conversation with Professor Chloë Ballesté of Spain, who is the director of the Donation and Transplantation Institute of Barcelona, as well as Sri Lanka's consultant urological and transplant surgeon of Sri Jawadharapura General Hospital, Dr. Niroshan Seneviratna. We will come back to talk about how one person's organs can save the lives of 8 others and improve 50 other lives after this break. Welcome back. We're in conversation with Dr. Chloë Ballesté of the International Development Donation and Transplant Institute of Spain and consultant urological and transplant surgeon at the Sri Jawadharapura General Hospital in Sri Lanka, Dr. Niroshan Seneviratna, about how one person can save the lives of 8 others and improve 50 other lives through the donation of organs. I'd like to turn to Dr. Chloë here. We were discussing about the situation there in Spain and how Sri Lanka's regulatory framework as well as infrastructure could be improved. But if you can maybe explain to us what deceased donation and live donation is and why deceased donation has become so important, if you also give us some statistics there in Spain, including in Europe.
Yes, absolutely. Well, the big difference in between deceased donation and living donation is, of course, that in living donation, it is an alive person who gives an organ. And the only organs that can be given is one kidney, because we have 2, so we can live with only one kidney, or part of the liver. While in the deceased donation, we can give up to 8 organs. But of course, organizing a living donation system is easiest, fastest, because you don't need to do all these organizations that I was mentioning before. So you've got countries like in India, in where 98% of the organs comes from living donation. But in Europe, as an example, in Spain, only 15% of our donors are living donors. And then you've got countries like China that are really also doing all the efforts to have living donation, and they have around 30% only of living donation.
So this means deceased donation plays a major part in saving other lives and keeping others alive. Dr. Niroshan, in Sri Lanka, we know there are a number of deaths where their organs can be preserved for the use of other patients, to keep alive these patients. If you can maybe relate to us the statistical situation.
Well, we know at the current situation that nearly 6,000 patients are waiting for a kidney. And this is a relatively crude figure, but the actual number must be even higher. And that's because we don't have a robust registry system. And if you take, for instance, about 5 to 6 people die every day from road traffic accidents, and majority of them would have had brain damage or irreversible brain injury. And these could have been potential donors. So imagine 5 to 6 per day, nearly 1,800 patients per year. You multiply by that 8, how many patients we could have saved? You know, but this is mainly predominantly talking about a situation which is called brain death.
Right.
But if you take Europe, and Professor Chloë would said, the brain death population in those countries are becoming less and less because of the improving of the highways, road safety rules, and so on. So most of the deaths happen, those are from what is called cardiac deaths. So patients who have a cardiac arrest, and those patients' organs can also be taken for transplantation. But unfortunately, our legal system in Sri Lanka does not support for cardiac donation. So that is another aspect we have to think of improving the fight for getting organs.
So which means you keep the patient alive, or how do I put this medically?
So in terms of cardiac death donors means once you, for instance, if you have a cardiac arrest and the doctors will give advanced cardiac support, chest compressions and so on,
right,
to keep the patient alive. But in certain situations, they don't, it's difficult and people will die because of a cardiac arrest. But then there are situations which we can give chest compressions through a specific machine and keep the blood circulation not to the brain, because the brain is already dead, but you maintain the blood circulation to the rest of the organs, where those organs can be utilized if the patient is willing for organ donation. And that is well established in Europe, and Professor Chloë will explain a bit.
Yes, I'd like to turn to Professor Chloë, but again, Dr. Niroshan, how do we really get this registry together? Do we have a registry at the moment? In Sri Lanka, we have been talking about this for years. We have many out of kindness, out of compassion, as part of religious beliefs, that they would love to donate, they would want to be a part of this this important mission. But how do you think the government or medical professionals as yourself can arrange for this?
So we have, with the collaboration of the Ministry of Health, in year 2020, we started this donor registration card, where people, when they are alive, can register themselves to become an organ donor if they become brain dead. So up to now, nearly 13,000 people have got registered in this system. So we encourage people to get registered and so that many people will pre-register before death so that they will give organs upon if they become brain dead in the future. But this has to come as a national interest, and that's what we want to build up so that there will be a national competent authority who will look this in a much more broader scale.
I think this should be a national initiative, just as in Spain, as Dr. Niroshan mentioned, to preserve organs of a patient, if correct me if I'm wrong, if my medical terms are wrong, upon brain death or cardiac arrest.
Exactly.
Am I correct? If you can also, while giving us that explanation, this is probably the last question I have. The myths surrounding, donations and accepting donations, especially when it comes to stem cells, skin.
Well, yeah, I think it's really important for the population to understand that all the healthcare system will do everything they can to make that that gift as beautiful as it should be, and that shouldn't have any repercussion on rituals, for instance, no? So once you have given the organs, you have, of course, some scars, but they will be treated as absolutely any other surgical procedure. So the family will be able to proceed with the rituals, with the funerary activities that they would like. Doesn't matter. I mean, it will not perturb that. That's one of the myths that usually exist, no? The defiguration and so on. Another one is about who can become a donor, no? And many people might think, no, well, my organs are not good because I'm old or because I've been smoking too much or drinking too much, but this is something that will depend. There is no very much absolute contraindications to organ donation, and it's case by case, and we have to look at the functionality of each organ.
Right.
No? So I think it's important for the population to understand that the healthcare system needs to put everything they can to make sure that this willing of donation is feasible, no? And the population can give. And of course, donation shouldn't avoid any other activity that the families are looking for.
Right, I think that's all the time we have, but one act of kindness at a critical moment, that decision you make can save the lives of 8 others. I think Sri Lanka is in the process of being a part of this massive mission, and still is, but I think this awareness will help take shape Sri Lanka's future in terms of organ donation, especially as the world marks Organ Donation Day on the 18th of February this year as well. We at Hyde Park thought of talking about this massive endeavor. Manusat Derana, the CSR arm of TV Derana at the Derana 24, has been a part of kidney disease solutions, as well as being a part of these clinics and organ donation throughout our 20 years as a TV channel. And this endeavor will also be championed by TV Derana and Manusat Derana going forward. Thank you very much for joining us tonight. We were in conversation with Dr. Chloë Ballesté, Director of the International Development Donation and Transplantation Institute of Spain. Thank you very much for your time here, not just in Sri Lanka, but also here at our studios. Thank you very much, Dr. Niroshan Seneviratna, who is the consultant urological and transplant surgeon at Sri Jayawardhanapura General Hospital and co-founder of the Organ Donation and Transplant Donation Foundation here in Sri Lanka. Thank you very much for your initiative as well. We'll see you again next week with yet another discussion here at Hyde Park on Athydepark 24. Thank you for watching. Good night.